Hello again. Another brief update on some of the key things that are impacting on the Trust. And I wanted to tell you just a little bit more about the National Staff Survey results. We've already communicated out, and I've done a brief email, and wanted to thank everybody that's taken the time to send their responses and thoughts in. So far, I think we've had about 50. I've tried to respond individually to everybody, but it might become a bit of a mammoth task, so apologies if I don't. We've also had a lot of really useful feedback on social media too. As I've said, this is a big hit for the Trust and really disappointing, not least because it's a continuing trend over the last 2 or 3 years, that overall the key parts of the staff survey, particularly around what it's like to work in the organisation, those key trends are in a deteriorating position. And they get categorised and looked at by division and geography. And within the categories, there are 10 key categories around engagement, quality of care, thoughts on the quality of care that the Trust provides, morale, and things like that. Of those 10, unfortunately, we're in the worst category for 2, which is around staff morale and staff engagement, and the others we're in the lower quartiles compared to our peer trusts, so other mental health, learning disability and community trusts. And that's not a great place to be. But I think my take on this is that it's an accurate reflection. It's a really important and valid assessment of where we are. So there's lots to do. I'm really optimistic and confident though, because wherever I go, and I'm trying to get out to see as many teams as I can, I'm overwhelmed by how passionate staff are about the work they do and their commitment to do the right thing for patients, and that's a great foundation to build on. And it's clear that in terms of some of our senior leadership and our living the values, we haven't quite got right. You may think, oh, that's an easy task to change. It is and it isn't. There are some straightforward things that we can do, I think, quite quickly to improve the environments and the working conditions and the bureaucracy, for example. But at the same time, there are some deeper seated things around the culture and the values that we aspire to, that we all have, that I think we need to work up into a more cohesive and telling picture of the Trust that we want to be. And that's around being compassionate and being kind, being proud of what we do, and having staff that feel that they're enabled to do the right thing for patients, families and carers. So it's a big task, we're on it. There's lots to do, but I'm hoping that over the rest of the spring and the summer, we can get out and talk to people individually, receive more feedback and do some really focused work in collating that together, so that come the autumn that we can really start to move forward and address some of these long-standing issues. So thanks for listening, and look forward to some improvements over the coming months.